Welcome to rePROs Fight Back, a podcast where we explore all things reproductive health, rights, and justice. I'm your host, Jenny Wetter, and I'll be helping you stay informed around issues like birth control, abortion, sex education, and LGBTQ issues, and much, much more. Giving you the tools you need to take action and fight back. Okay, let's dive in. Hi, rePROs. How's everybody doing? I'm your host, Jenny Wetter, and my pronouns are she, her. So, y'all, it has been a little while since the SCOTUS decision. We've all had a chance to sit and try to work through all of our feelings around it. It took me a while before I finally had a day where I woke up and was like, okay, I feel ready to face this day, and didn't have that numb or just sadness and anger over me. So take your time, feel your feelings. You know, I kept working and kept fighting through all of it, but it really took me a while to reach that point where I felt like I was in a better place. I don't know that I would say good yet, but definitely in a better place. You know, I took that first weekend after Dobbs came out overturning Roe to really I had some things I had to do, but also to try and disconnect a little bit and really focus on self-care so that I would be ready for the week ahead. I kept it fairly low key, did some work and scheduling some things I needed to do, but also just took some quiet downtime. I made cinnamon buns, which were delightful. I decided that the recipe that I had been using didn't have enough frosting when I made it the first time. So I decided to double the amount of frosting, which was definitely too much. But you know what? Is there too much frosting? Can you have too much cream cheese frosting on cinnamon buns? I don't know. They were delightful, and they were really what I needed to face that next week, to have them for breakfast every week. I just wanted to touch on a couple things before we get to the bonus interview. Some things that you've been seeing a lot of online that I just wanted to quickly address. And I think, this audience probably knows most of it, but it's helpful to restate it. And so we'll just address a couple of the things. And one is to make sure that we're using trans-inclusive language, right? Trans and non-binary people access abortion care. It is really important that we do not exclude them from this conversation. They are already being attacked on so many fronts. It's really, really, really important that we are being inclusive. And honestly, it doesn't cost us anything to be inclusive, to talk about pregnant people or people needing abortion care or abortion patients. It costs us nothing, and it means so much to be inclusive. So just, try to watch your language. It takes time to learn, and you'll mess up and you won't be perfect, and that's okay. But just, try to be inclusive. Another thing that you still see a lot of is coat hanger imagery. And, I understand that it comes from from pre-Roe times and what criminalized abortion looked like. That is not the world we are living in now. There are medication abortion pills. There are safe alternatives. We don't want to use coat hanger imagery because it might scare people away from accessing safe abortion. And that it's really important to point out that even though abortion in places is criminalized, self-managed abortion using medication abortion is safe. And there are resources out there to find it. rePRO Action has information on it. The World Health Organization has information on it. We Testify, I have seen with information on it. So, make sure that people know that there are safe alternatives. I think it's also really important. We already do this a lot, but, make sure that we're elevating the work of abortion funds. You see a lot of people trying to duplicate work that is already being done by abortion funds. And so it's just really important that, letting people know that that's already happening and that abortion funds are already doing a lot of this work. Yeah, I think those are the main ones. And then just, making sure that we're not stigmatizing abortion, not giving impressions that there are good abortions or bad abortions, or this is an okay reason to have an abortion, or talking around abortion, right? We don't need to be talking about pro-choice or things like that. It's really important. Abortion isn't shameful. We should not be doing the work of stigmatizing it. So, please say the word and talk about abortion as you are talking about why this is so important. Yeah, I think those are all the things I wanted to hit on. Those are things I've been seeing a lot online, and especially the stuff around not being trans inclusive. There's just been a lot of nonsense around that online. And it's so important, y'all, to just be inclusive. Trans and non-binary people need abortions, and we do not need them to feel like they are not welcome in this space. They are loved. They are supported. We need to make sure that everybody is able to access the abortion care they need. And that includes trans and non-binary people. So by talking about this as a women's issue, we are excluding them. And yes, this predominantly will impact cisgender women. They're not the only people impacted. So we need to make sure that we are including everybody who will feel the impacts of the loss of abortion rights. And with that, let's turn to this week's bonus interview. I am so excited that we have finally made this happen. We have Garnet Henderson. She is an independent journalist, but she also hosts the Access podcast. Y'all, it's a really wonderful podcast. She does a great job producing it. She does it all on her own, beginning to end, and it is so wonderfully done and talks about so many important abortion-related issues. It is definitely worth your time if you are not already part of her audience to become part of her audience. So please check out Garnet's podcast, Access Podcast. You can get it wherever you listen to this one or wherever you are getting this one. I'll make sure to include links in the show notes. For sure, check it out. And with that, let's turn to my interview with Garnet. Hi, Garnet. Thank you so much for being here today.
Hi, thank you so much for having me. I'm excited to be here.
I am so excited to have you on the podcast. Do you maybe want to take a second and do a quick introduction of yourself and include your pronouns?
Sure. My name is Garnet Henderson. I use she, her pronouns. I am an independent journalist and the host and producer of Access, a podcast about abortion.
And I guess before we dig into anything, everybody should check out Garnet's podcast. It's really amazing. But do you maybe want to take a second and tell people about it? Because it's obviously right in our audience's wheelhouse.
Yeah, sure. So I created Access because this will probably not be surprising to anybody who's listening to this show, but I was really finding that most people knew almost nothing about abortion, including and perhaps especially people who considered themselves liberal or progressive and generally well-informed. So, I, as a journalist, was always interested in reproductive health and other feminist issues. But over the years, I made abortion access more and more my beat. And so I would talk about abortion everywhere I went, at parties, on dates. And I really found that people would be just so surprised when I told them things that I considered to be really basic facts about abortion care or about abortion law and policy, right? And I also found that editors often knew very little about abortion. And so it was really hard to convince them that they should take a story that I was pitching them about abortion. And because I do also write about other things, I do have that comparison. So it's true that as a freelancer, I'm always trying to convince an editor that they should take my story, that this is a story they want to publish. And I just was finding that with abortion, it was much, much harder, or that they were always wanting it to be a really extreme or dire or sad story. Like I often was hearing when I pitched things basically like, well, this isn't bad enough yet. Let us know if things get worse. And so I wanted to create access to really help people understand some of those things that they don't know about abortion, because I do think that so much anti-abortion sentiment and policy is just driven by stigma. So I wanted to break things down in a really accessible way, one topic at a time. And I also just wanted to be able to tell the stories that I wanted to tell and that editors weren't very interested in.
Yeah, I totally feel that. Our podcast had kind of similar, but I think the biggest thing that really where I felt that story was having conversations. I'm originally from Wisconsin. I would go back home and would be talking to people, and they didn't realize how much abortion was being regulated, or various rePRO things were being regulated like in Wisconsin, because it wasn't getting the coverage that a lot of other states were getting. And we're talking, I guess now like 11 years ago, because this is when we started the 50 state report card that the Population Institute does every year. And we've been doing it for a decade now. And like, it was really trying to fill some of that gap of like, this is happening everywhere. You need to know what the policy is in your state, because you may think your state is good, but it probably still has some bad policies, whether it's sex ed or covering abortion or so many other things, that we wanted to make sure that people were able to learn about that. And, you know, obviously then that leads to doing rePROs, where really we started with the Trump administration because there were so many things happening and people were having a hard time keeping up. And we wanted to make sure to have a space to like really dig deep and talk about all of the issues and why people needed to care or just understand like what it meant.
Mm-hmm. Yeah, I grew up in Wyoming, and for most of my life, lawmakers in Wyoming really weren't interested in trying to limit abortion access, but abortion access in the state was really bad. So I'm from Jackson Hole, which for my whole life my whole childhood had Wyoming's only abortion provider, who was just our local urgent care doctor too. So like he cut a piece of glass out of my foot once at his evil abortion mill.
Yeah,
you know?
yeah. Yes, you do.
Yeah, exactly. And so then I moved to New York for college, and I've lived here ever since. And, you know, I think in Wyoming, people obviously knew that it was hard to get an abortion there, right? And then I moved to New York, and I realized that, you know, a lot of people, I think, living in New York, and like you said, states that people think like, oh, this state must be good. Like this is a quote unquote blue state. But actually, you know, there are still lots of barriers and challenges to abortion access that people aren't aware of until they themselves or someone close to them needs an abortion. And so that was definitely part of my inspiration for creating access as well.
So now that we've had a little while to like sit and marinate in the awfulness of what happened last Friday, maybe let's talk a little bit about what happened that day, because I know you had an opportunity to talk to people at clinics and see what was happening on the ground, because I think those stories are so important to tell for so many reasons.
Yeah. I mean, it was just really heartbreaking, especially because everyone knew that the decision was coming and really hoped it wasn't coming for another week.
Yeah.
But then I think a lot of us kind of knew that it was going to be that day somehow. Like all of a sudden, I remember I barely slept that night, and I woke up like, what is wrong with me? And I was like, I think today is the day. And it was. And so talking to people at clinics around the country in banned states, they were just trying so hard to fit in as many people as they could before any decision came down. I talked to Dr. Bhavik Kumar at Planned Parenthood Gulf Coast, who's been a guest on my show, and he was telling me that there they had moved up their start time with patients to 7 a.m. in the hopes every day of getting in as many patients as they could before any decision would come down, which in Texas, they're on Central Time. So decisions start coming out at 9 a.m. Central Time. And so, they were just trying to pack patients into those early morning hours. But then that meant on the day of the decision, they had some patients who had been able to get their abortions and others that they had to send home pregnant who were still there in the waiting room. And now, of course, hopefully some of those people maybe are getting in now that there's a temporary restraining order blocking the Texas pre-Roe ban. But, given that access there was already so limited with the 6-week ban, which is still in effect, I have a feeling that a lot of people who were delayed even a couple of days might have to travel out of state anyway, which is really difficult, especially because a lot of abortion funds also suspended their operations while they were kind of seeking clarity around that pre-Roe ban in Texas to figure out exactly what was and wasn't legal and what was and wasn't safe to do. So, there's been a really robust network in Texas working to get people out of state if needed, working to get people the funds that they need to do that. And a lot of that was, if not fully, at least partly shut down starting on the day of the decision, which is really, really difficult and just sad, especially because I know that those clinic workers and organizers in Texas have really been pouring so much work and truly heart and soul into helping abortion seekers in the extremely restrictive context there. And it's so hard to see them have to stop that work in any way. I also spoke to Robin Marty, who I'm sure everyone who listens to this show knows who Robin is, at West Alabama Women's Center. And she told me that they had almost 100 patients booked for this week. So that's people who had already made it through their first appointment because Alabama had a 48-hour mandatory delay. So that was almost 100 people who had already made it through their first appointment where they get an ultrasound and the state-directed counseling, and were just waiting to come back in to either get pills or have an in-clinic abortion. So, that's also devastating in a state where it was already so hard to get an abortion, and to have to jump through so many hoops to have made it through almost all of them and to be cut off at the last second. Yeah. And then I spoke with Mia Raven, who is a clinic employee and also an escort and the founder of the Powerhouse, which is a reproductive justice organization in Montgomery, Alabama. So she works and volunteers at Reproductive Health Services, which is another Alabama clinic. And Friday is not a clinic day for them, so the clinic was closed. But she told me that they had, where they'd normally have about 20 people on Monday and Tuesday coming in for their initial appointments, they had upwards of 40 scheduled for Monday and 30 some for Tuesday. And all those people's appointments had to be canceled. And she said that, even though it wasn't a clinic day and the clinic wasn't open, protesters started showing up as soon as the decision came down, not surprisingly. So she was there when I spoke with her, sitting in her car outside the clinic, kind of keeping an eye on everything. And she told me that in the time she'd been sitting there, 5 former patients of the clinics came up just because they didn't know where else to go other than the place that had helped them. And so they wanted to come and find out what was going on, what they could do, and also just tell the clinic staff that they were sorry, which I thought was really heartbreaking.
There's just so many layers of heartbreak in all of this. Like, thinking of all of the patients or people who need abortions who are blocked from getting one, may not be able to travel, had already gotten so far through the process. Like, that's devastating. But also thinking of the clinic staff, like, I know how, like you, as soon as they added the Friday decision day, like, I just had this sinking suspicion in my stomach that that's what was going to happen. Yet somehow woke up Friday morning being like, no, we're going to get this weekend. We're going to get this weekend where people are still going to be able to access care, which obviously was not true. And the way it hit me, like, I knew what was coming, right? But it still hit so much harder But then to think of like being in a clinic and like having to not only be trying to process my feelings and like how it's impacting me, but also trying to help patients and like talking to people who had appointments and like trying to talk them through their options. Like, oh man, like clinic workers, like I just feel for them to have to go through all of that and process what happened all at the same time. Like it's so much.
Yeah, it's really, really traumatic. And, at a lot of clinics, their busiest day, and in some cases, their only procedure day is Saturday. And so a lot of clinics got cut off right before what would have been their busiest day of the whole week, where they would have helped the most patients. And yeah, I mean, I spoke with several providers who said, like, we had to turn the phones off for a while and just put on the answering service because there were so many calls and we wanted to be able to answer all of them, but we didn't really have information for people until we figured out exactly what the ruling was going to mean for us, because we're also in a really confusing situation now where all these different state laws are coming into effect. There are pre-Roe bans that are so old, and there's a lot of uncertainty about how attorney generals in various states might try to enforce those. There are federal judges rapidly lifting injunctions against more recent abortion bans and allowing them to be enforced. But, we're now in this really confusing state by state kind of patchwork of laws. In some states, the bans are being challenged in state court, and hopefully that will be successful in at least some places. It has been temporarily successful in a few states for the moment, but that's another thing that's just really hard on clinic workers, is when the situation is that confusing and is changing that rapidly, it's really hard to give people good information. It's hard to be able to say anything to them other than like, keep an eye on the news, or make sure you call us right before you come in, or something like that, because there's no way you can tell people today what the situation is going to be in tomorrow or 3 days, at the time of their appointment.
Yeah, I think that's something that is becoming really crystal clear. Like we talked about the lack of information, like why you started the podcast, why we had been doing some of the things we were doing. And like now the need for accurate, up to the moment information is more important than ever. There's just so much confusion everywhere, right? Like even in states where it's still legal, there isn't a trigger ban. Like people are hearing the news that Roe is overturned and assume that means they can't get an abortion, or people not hearing the news in states where it is illegal. Like there's just so much confusion, and the need for accurate information is just so important. I mean, you see so much flying around, especially like on Twitter, where everybody's an expert, right? And you really have to make sure you're getting information from trusted sources.
Yeah, absolutely. And, the trigger bans in particular are very confusing because some of them require no further action. They go into effect automatically. Others require some kind of executive action from the governor or the state attorney general. And so, it's just a mess, which of course is, whenever there's confusion and there's a mess, that also creates an opportunity for anti-abortion groups to swoop in and lure abortion seekers in and confuse and delay them further. So that's something I've been thinking about a lot too, given that crisis pregnancy centers in particular already have such a long track record of impersonating real abortion clinics, moving in next door, across the street, or even into the old space of a closed clinic or a clinic that has moved. And so I've been thinking about that a lot because I think a lot of anti-abortion groups are ready to kind of swoop in and fill in that information vacuum, and try and trick people basically into not doing what they need to do in order to get out of the state if that's what's required where they live and have an abortion.
Yeah. I mean, so much. And there are so many more of them than there are abortion clinics, right? There are, like, every time I see the number of like crisis pregnancy centers, it is utterly shocking to me how many there are. Yeah. And just getting that wrong information can be so harmful, right? Like, if there's like a week ban in your state and they tell you you're past it, but you're not, and then so you don't go and seek further care, there's just so many things. And, I think this also came up, and I was just re-listening to one of the episodes of your podcast where you were talking about the woman who needed a later term abortion and was not being counseled on all of her options right away. And just thinking of how that's going to really, I mean, it already happens, but like how much more is that going to happen now?
Yeah. I mean, that's one of the reasons why it was so important to me to tell that story, because, I try to there's a stereotype, or a misconception is a better word, I guess, that the only reason that people have abortions later in pregnancy, and particularly in the third trimester, is because of some kind of a fatal fetal diagnosis or pregnancy complication. And of course, it is true that that is a major reason that people have abortions, particularly in the third trimester. But of course, most people who have abortions later in pregnancy are people who wanted an abortion earlier and were not able to access one for all kinds of reasons, or, didn't discover that they were pregnant until the second trimester or into the third, which is far more common than people realize. So I always try to be careful in how I tell those kinds of stories about people who are having abortions for fetal indications, because I never want to reinforce that idea that that is like the good reason to have an abortion at that point in pregnancy. But I think what was really important to me in telling that story of Kristen Smith, who's my really brave guest who came on to tell her story, is that she actually experienced a combination of those things. So yes, she did receive a fatal fetal diagnosis, but she received it at 20 weeks, at which point she still could have had an abortion theoretically, legally in West Virginia, although I don't know that there are any providers that actually would have done it, right? But it was legal. So according to the American College of Obstetricians and Gynecologists, when a patient is receiving a diagnosis in their pregnancy that's potentially lethal, they're supposed to be counseled on all their options, and that includes abortion. But Kristen's doctors in West Virginia never even spoke about abortion with her at all. They immediately referred her to a team of specialists in Cincinnati, which is a 3.5-hour drive from her home, to try and have a fetal surgery. And when that didn't work, those doctors did speak with her about abortion, but at that point they couldn't offer her an abortion because Ohio has a 22-week ban, or had. Now it has a 6-week ban. At the time, it had a 22-week ban. And so they basically just sent her home to West Virginia to wait to have a stillbirth, which I think is horrible.
Yeah.
Yeah. And so she actually had found out through a midwife at her obstetrician's office about DuPont Clinic in DC, and she had an appointment there, but she ended up in the hospital in West Virginia with some bleeding before she was able to get there. And they really wanted to treat her as though she were in preterm labor and was potentially going to give birth to a healthy baby, which was just not possible in her situation. So it's a really disturbing story. And she did end up ultimately getting an abortion. She had to drive 6 hours to DC while still bleeding, while she really should have been in a hospital in order to get the abortion that she needed. And so it was important to me to tell that story because I think that unfortunately there are about to be a lot more people like Kristen who don't get the counseling about abortion that they need and deserve, and who are forced to wait until they're experiencing really difficult and dangerous complications to be able to get an abortion. And I also think it shows that abortion stigma harms and delays those people, even who have quote unquote good reasons for getting an abortion. Like, there are lots of people who would not consider other reasons valid for having an abortion at that point in pregnancy, but they would consider Kristen's reasons valid, right? She had a fatal fetal diagnosis and complications that were threatening her own health and safety. But even then, she was delayed. I mean, she initially received this diagnosis at 20 weeks, and she wasn't able to get an abortion until 27 weeks. It's a 7-week delay, which is excruciating.
Yeah. And like, as we know, like the later in pregnancy, the price also goes up. So like that goes into the like other reasons why people delay, right? Because it takes time and to raise money, and there are just so many reasons, and all of your reasons are valid. Like, there is no good or bad abortion. There's just the abortion you need or want. There's just abortion. It's healthcare. I just found it really important to hear her story again, just thinking of like what overturning Roe is going to mean and how it's going to impact even more stories like this and so many other stories.
Mm-hmm. Yeah. And another thing I wanted to highlight about that story too is that even when we still had Roe intact, it was incredibly difficult to get an abortion later in pregnancy. And now we're about to have a lot more people who need abortions later in pregnancy because they're going to be so delayed by bans in their home states. And, you know, even in those quote unquote blue states, a lot of blue states really don't have good access to later abortion care either, which is one reason why it's exciting to me to see Partners Clinic opening in Maryland. DuPont Clinic is there in DC. You know, we need more of those clinics that offer abortion care in all trimesters because that's about to become much more in demand.
Yeah, and even if you're in those like safe blue states, like where do you think the people are going to go who are in states where it is banned? Like those states are not, like, no one is equipped to handle this kind of influx that a lot of these states are going to see.
No.
So you're going to see delays everywhere. I think more and more, like, I really just chaos is like the most apt term for what we're going to be seeing going ahead.
Mm-hmm.
Okay. There was one more thing that's been going around that I wanted to talk to you about because I know that you have had conversations about this. And that's the meme that's been going around about we'll adopt your baby. So I know you've done some reporting on this, or at least have had conversations around it. Why is adoption not an alternative to abortion? I think a lot of people just like throw it out there like, yeah, no, just give the baby up for adoption. Like, why is it more complicated than that?
Yes, this is actually what the next episode of Access is going to be all about. And it was inspired by a storyteller who reached out to me who has herself placed a child for adoption in her teens and then later in her 20s had an abortion. So she's had both of those experiences. And she says that her adoption experience was traumatic. And her abortion experience was not. It was really empowering and positive for her. So, you know, I also spoke with Gretchen Sisson, who researches adoption, and she was one of the researchers who worked on the Turnaway study. And what they found in the Turnaway study when, you know, they compared people who got their wanted abortions and people who were denied wanted abortions is that I believe 91% of those people chose to parent the children that they had. So first of all, not very many people choose to place a child for adoption, even when the pregnancy was not planned and they might have preferred to have an abortion. Although Gretchen did make an interesting point that even though that's kind of from one perspective a very small number, right? Like the vast majority of people choose to parent. She pointed out that actually that stat is kind of similar to the pre-Roe relinquishment rate. So we may actually see similar numbers of people place their children for adoption as we did before Roe, even though that is overall a very small proportion of people who are dealing with unplanned pregnancies, if that makes sense. But adoption is complicated both for the parent who is placing their child for adoption and for the adopted child. It's very emotionally complex. And parents who place children for adoptions really don't have a lot of rights in most states. So one thing I learned in this process of reporting this episode is that in most states, you can have an agreement with your child's adoptive parents about, how open the adoption is going to be and what level of contact you're going to have with the child. And you have no power really to enforce that. So the family that has adopted your child can essentially at any time, again, in most states, choose to just stop following that agreement that you reached. And so, I think there's this idea, particularly now, like, oh, adoptions are so great for everyone, right? Like they're so open. Birth parents just have all these opportunities to be in their children's lives in ways that they usually were not pre-Roe. But it's just not true. And that's one thing that Nikki, the storyteller I spoke with, talks about, is that the family that adopted her child did end up cutting off contact with her for a period of time. And it was really difficult and painful and confusing for her. And so she's only now kind of getting to know her child again. So I think when people present adoption as an alternative to abortion, first of all, adoption is an alternative to parenting. It's not an alternative to pregnancy. Abortion is an alternative to pregnancy. So, suggesting that it's no big deal to place a child for adoption ignores the fact that pregnancy is incredibly difficult and demanding and dangerous in this country, especially if you are a person of color and especially if you're a Black person. And then it also ignores the fact that adoption is very emotionally complex and often painful for both the birth parent and the adopted child, which isn't to say that there aren't adoptive parents out there who are great parents who really mean well and who are, loving, supportive parents to their children. It doesn't change the fact that it's very complicated and can be difficult.
Yeah, I think that's so important. Drawing that distinction between adoption being the alternative to parenting, not to abortion, because you still have to go through pregnancy. And
no,
as you said, like it is not a zero risk thing.
Yeah.
Right. Like
Absolutely.
It is so dangerous in this country. Well, I'm glad we were able to dig into that because, man, that meme has been everywhere. And, it also takes me back to, when the case was argued and, Justice Coney Barrett being like, oh, well, there are safe haven laws. And like that's an alternative to abortion, right? Like these are not alternatives to abortion. They're alternatives to parenting.
They are. Yeah. And I think especially the way she said that to me came across as so flippant. And I think that's really insulting. It's really insulting to pregnant people. And it's also insulting to adopted children and adults who are adoptees, because clearly, there's nothing simple about it.
Well, as we like to end the podcast with not despair in the moment, but an opportunity to take action. What can people do right now? I'm sure people are more energized than ever to get involved. What are some actions people can take?
I always suggest donating to or fundraising for abortion funds. Another thing that's going around is lots of people wanting to offer their spare room to strangers to come and stay with them if they need an abortion, right? And, I do think that lots of people mean well in wanting to do that. But it's important to remember, first of all, as we've already touched on, that anti-abortion groups are just looking for opportunities like that to intercept abortion seekers. I would bet you $1 million that you have people who are involved in anti-abortion groups out there making those offers. Come and stay with me. And then what do they want to do? They want to be like a crisis pregnancy center, except worse because you're in their house. And now they're going to try and convince you not to have an abortion or prevent you from doing it. That's really scary, right? So it's important that any organization that is working with people to host abortion seekers, and there are some, that they be able to vet people and make sure that they're safe. So if you want to prove that you're a safe person, you should really get plugged in with your local abortion fund and figure out what kind of help they need. You know, if that's money, whether that comes from you or it comes from you having some kind of a fundraiser to get other people's money, that's great. Or if they need volunteers, to really get plugged in with them and prove yourself to be that kind of trustworthy person. And then I also think that independent clinics really need support. Going back to our conversation about clinic workers, they are working so incredibly hard and they're dealing with just awful, really traumatic circumstances this week. And frankly, they have been for a long time in a lot of states. And it's really independent clinics, meaning those not affiliated with Planned Parenthood, who have been leading the way in providing abortion care in the most restrictive contexts and still are leading the way. And, you know, a lot of indie clinics in states that are banned states now are looking to reopen in other states. You've got Red River Women's Clinic in North Dakota that's going to move across the border to Minnesota. You've got Choices in Tennessee that is staying open there, but won't be able to provide abortion services. So they're opening a new clinic in Illinois. I believe Jackson Women's Health, the clinic in Mississippi at the center of the Dobbs case, is looking to move to New Mexico. So that's another great opportunity to support abortion care, is to figure out what independent clinics need. Again, if that's your money or money that you can raise from other people, or check in with them to see if they need volunteers, check in with your local clinic wherever you live to see if they need escorts or other volunteers to help them out with this huge influx of patients that they're about to see.
Yeah, those are all great suggestions. People can donate to independent clinics directly, or there's Keep Our Clinics, which funds independent clinics, which is also a helpful place to find information. Well, Garnet, it was so wonderful talking to you. Everybody, make sure to check out the Access podcast. We'll make sure to have links included in our show notes. It was so great to finally get to talk to you.
Yeah, it was great talking with you too. Thanks so much, Jenny.
Okay, y'all, I hope you enjoyed my conversation with Garnet. I had a really wonderful time talking to her about all of these issues, dealing with a bunch of technical difficulties. Both of us were having some internet issues, so we had to start and stop a couple times, but really grateful we were able to have a wonderful conversation. For sure, make sure to check out her podcast, Access the Podcast, available wherever you get your podcasts. We'll have links, don't worry. If you have any topics you would like us to cover or questions, always feel free to reach out to me at jenny@reprosfightback.com, and that's Jenny with an IE. Or you can reach out to us on social media. We're at rePROs Fight Back on Facebook and Twitter, and rePROs FB on Instagram. Otherwise, I will see y'all next week. For more information, including show notes from this episode and previous episodes, please visit us at our website at reprosfightback.com. You can also find us on Facebook and Twitter at rePROs Fight Back, and on Instagram at rePROs FB. If you like our show, please help others find it by sharing it with your friends, and please rate and review us on Apple Podcasts. Thanks for listening.